Good afternoon from the Brazos County Health District. Thank you for your attention this afternoon as we go over some important topics related to COVID-19 in the past week at Brazos County Health District. Thank you again to Sherry for your help, as always. Our collaborators today, Judge Peters, Mayor Mooney with us, Mayor Nelson, and Mr. Chad Wooten, Texas A&M University External Affairs, with us as well. I'll do a situational overview today. Positive cases, we'll go through those, and then an overview over the past week, what's happened, some information about face masks, COVID-19 response system, some community partnership, as well as some information out there circulating about fake COVID-19 treatments, information about high school graduations, local sporting events, and then, of course, some time for question and answers. So quite a bit of information to get through, so bear with me as I move through that quickly. I know there'll be some questions at the end. As of June 22nd, there have been 16 additional positive cases of COVID-19 reported to the Health District. This brings our total number of positive cases to 1,260, 1260. Total number recovered, 608. Active cases estimated to be around 627. Number of current hospitalizations, Brazos County residents at 31, Brazos Valley 52, the Greater Valley. We've talked about that in numerous press conferences before. Local hospitals are at a 65% capacity. This percentage is fluid, very fluid, changes by the hour, and is constantly being monitored. Number discharged in the past 24 hours at 9. Total number of deaths remains at 25. Testing to date, 12,318 tests. As we look back over the past week, 1 week ago, we've had an additional 379 cases. These numbers, as you've noticed, we've talked about that over the weekends. We see less cases reported. That is really just a flow issue. That doesn't mean there's less cases being transmitted on weekends. That has to do with staffing issues. So this is, if you look widely throughout the state of Texas or throughout the country, you'll see the same phenomenon. Of the 379 cases over the past week, 46% have been in an 18 to 24-year-old age group. 46%. We talked about positivity rates, the rates of how many positive tests we have to how many tests we're sending out. That number also is increasing. The week of June 6, we were at 9.93%. As of week of June 13, 24%. There must be a balance between reopening the economy and preventing the further spread of COVID-19. Indeed, to continue opening our economy, there needs to be a break on how much COVID-19 is spreading. This is that balance that we have talked about through Operation Restart. Businesses are given the tools to reopen safely, but prevention measures must be followed by everyone at work, at home, in the community. Around the state, the Texas Alcoholic Beverage Commission is closing overcrowded bars that are not following the Open Texas guidelines. Alcohol permits can be suspended for 30 days if the establishment is not following the capacity guidelines. Because the number of cases continues to increase in our community at an unacceptable rate, we must be accountable for our actions to prevent the further spread of COVID-19. We need to be wearing masks when in public, especially in closed spaces. Practicing social distancing, the 6 feet radius that we've referred to, and only being out when we need to be out, and washing our hands frequently. A lot of concern about face masks, clearly, a lot of debate about this around the country. Face masks can keep Brazos County and the state of Texas open for business. That is, we heard the governor's address today. While people who are sick or know they have COVID-19 should isolate at home, shouldn't be out at all. COVID-19 can be spread by people who do not have symptoms and may not even know they're infected. So we know that if you have symptoms, we shouldn't be out at all, and a mask is not helping much there if we have symptoms. But the point of the mask is that even before those symptoms present, that we could be contagious. And so the idea of a covering helps decrease those secretions to the environment and to our fellow neighbors. Tips on wearing a face mask: it's hand hygiene prior to putting on the face mask. Cloth face masks can be washed with regular laundry or can be hand washed. some questions that we've received about how to dispose of the disposables. Those should be discarded in a plastic bag and then thrown into the trash. We've seen those strewn about and littered, and that's obviously inappropriate. What about our COVID-19 response system? The local COVID-19 response system is strained due to the increasing number of cases. Local healthcare providers may have longer wait times for testing, which in turn delays reporting of positive cases to the health district. We've seen, you could think about it as an upstream phenomenon. How many folks are presenting for the test then gets sent, the test get resulted, and then that result comes to the Brazos County Health District, where that then the case is investigated. That's a process in which the individual is interviewed, the test is confirmed, and then we go on to the case investigation part of that. We find who around the contact investigation, who around the case was exposed. And that's that boxing it in phenomenon. So this is an upstream phenomenon. We have seen a lot of individuals at urgent cares and emergency rooms really this past week and in through the weekend, very, very busy with COVID-19 related infections. All information shared by the client with the health district is confidential, including the information for their close contacts. Contacts will not be notified of the person who they were exposed to. They are just notified that they are a contact, and they're given the information then to act accordingly. If the healthcare district staff does not reach the person, they'll leave a message asking them to call the health district. Please call back. We've had issues with individuals calling us back about this, but that's what that's about. This is a public safety issue. This is confidential information, and this is for your information, for your safety. It is important for anyone to follow, of course, the information that they are given thereafter. Community partnerships. To help with the local response system, the Brazos County Health District is partnering with Workforce Solutions and Texas A&M University to create a COVID-19 investigation operations center. Over 50 positions will be hired as case investigators, contact tracers, and epidemiologists, all part of that boxing in strategy that we previously referred to. Anyone who is good at empathy and talking with individuals and has good verbal skills should apply at www.workintexas.com. Noble mission. Fake COVID-19 treatments. The only at-home treatment for COVID-19 is rest, hydration, over-the-counter medications such as acetaminophen or Tylenol. Fraudulent products that claim to cure, to treat, to prevent COVID-19, these have not been evaluated by the FDA for safety or for effectiveness, and they may be dangerous. So please be aware of these treatments. High school graduations the high schools are taking necessary precautions for graduation ceremonies. Students are required to wear masks. It's recommended that all guests wear masks as well. Social distancing measures will be followed before, during, and after the graduation ceremony. Although this is a special time, we do encourage you to celebrate your graduation with a small gathering instead of large graduation parties. Indeed, when we do our contact investigations, there are large parties that are happening that many individuals will become positive from. It is this social distancing concept that we have been seeing for months that we've been discussing. Local sporting events. The Health District has been in close communication with the City of College Station Parks and Recreation Department about this upcoming 35th annual Budweiser softball tournament scheduled for this weekend. The City of College Station is working closely with the tournament coordinators as well as the City of Bryan on safety protocols. Balancing public health safety and stimulating the economy is crucial. These can occur if the plans are in place and executed correctly. Health District has reviewed the tournament safety protocols. Residents, visitors, and event planners must be accountable for their behaviors and practice the prevention measures in order to meet this balance. City of College Station notified the Health District that staff will be on site throughout the event to handle field preparations, bathrooms, and trash pickup. They'll also be working with the tournament staff to ensure the safety protocols are being followed and will identify areas that need improving. Hand sanitizing stations will be in each of the dugouts for players and coaches to use during the games. The City of College Station staff and Health District staff will be contacting cities that have hosted tournaments similar to this previously in fact, just this past weekend, to determine if anything needs to be improved. Lessons learned, if you will, from this past weekend that we can move to make things safer for this particular coming event. So, a lot of information. Sorry to barrel right through that, but I know there's some questions and concerns. At this time, we'll open it up, and we'll be starting off with KAGS, if you can hear me okay.
Hi, yes we can. Hi, Dr. Sullivan, Gabriella.
Hi, Gabriella.
Hi, I was just wanting to know, I had a few of us question, but I know it's kind of broad, but what is the plan for when A&M students start coming back to town? Because that'll obviously cause maybe a little bit of spike in numbers in the future, or a little bit more strain on the hospitals around town. So what do you guys have in mind for that situation when that starts happening?
Yeah, so Gabriella's question is about what about this fall? So we're talking about numbers here and 19 to 25-year-olds that we've identified, and so what about this fall when the university opens up? And I can tell you, Gabriella, and all of you concerned appropriately, the university has been absolutely on this and are monitoring this every single hour of the day. We've been in touch with the university throughout this for months. We've been collaborating on this, and the university has an intense interest in doing this safely, and some very impressive environmental controls, and lots going on there with the university. Of course, we're concerned, Gabriella. We're concerned whenever there is that possibility for this social distancing to not occur. And at the end of the day, that's what this is about. You know, can the university open safely? Yes, it can if we do these things. You know, can bars and restaurants open? Yes, if we do these things. So this all gets down to executing the plan that is there. And I can tell you they have a great plan. They have a great plan around students and faculty. And so there'll be more on that coming. I'm sure that, you know, university officials, again, Mr. Wooten's here if he'd like to speak to it too. But I mean, this has been a huge and impressive effort from the university, and the university is watching very closely here today, and continue to be in coordination with the health district about what's happening, about how we can improve the safety of all the community members here in the Brazos Valley. Gabriella, does that answer your question?
Yes, sir, thank you.
Okay, you're very welcome. And as mentioned, Mr. Wooten is here if there's further questions or more specifics there. And on to WTAW.
Thank you, Dr. Sullivan, Bill.
Yeah, hey, Bill.
Unfortunately, two things I'm curious about. You made the reference to strained facilities. I'm curious just how strained the hospitals are with the overall number of not only coronavirus cases, but also how ICUs are being taxed. Also, I'd like to ask Mayor Mooney for comment on the College Station City Council's consideration Thursday regarding requiring businesses to require patrons and employees to wear masks, and carry that over to Mayor Nelson and Judge Peters, whether that will be considered anytime soon by the Bryan Council and the Brazos County Commission.
Gotcha. Okay, Bill, and I'll repeat your question. Please correct me if I'm wrong. But so it was around strained facilities, directed to me about where our facilities are now and the strained situation that we've been monitoring, and then some questions around for our elected officials around masking. So let me start off with the first part of your question, Bill. The strained facilities. This is, we've been talking about this for 3 months. The concern is the cases that we have, the pressure that it puts on our vulnerable population, and that vulnerable population requiring hospitalization, ICU, ventilator resources. And this is what we've seen in other areas of the country, which we want nothing to do with here. We want to protect those resources and keep this community safe. And so we have an intense interest in those numbers. We reported last week this was the first time that we had really started to see that strain of those resources. And we've been reporting percentages, and those percentages are interesting, right? There's a percentage of how many beds there are, but there's also a percentage of how many what we call staffed beds, or how many we have folks for, you know, at this time. So there's some flexing that can occur there. So the denominator, if you will, can even change. So this is very, very dynamic. We do have plans in place. We have plans in place if those numbers exceed. And our healthcare administrators have been working on this for months, working together and working with our emergency responders and working with the elected officials here to ensure that we have a good plan, a good backup for that. But we don't want to go there. We don't want to be surging beyond these numbers and having to implement these plans. But we have a plan after a plan after a plan. And so the key here is that we don't get there. And so right now we're seeing a lot of young 18 to 25-year-olds who have gotten this, and that's not a high-risk population to require hospitalization. Make no mistake, there are 18 to 25-year-olds who will require hospitalization. This is a numbers game. It's less likely, but it can happen and will happen if we have too many 18 to 25-year-olds getting infected. But the challenge becomes if those 18 to 25-year-olds end up pushing and pushing and pushing. So where we are seeing this particular spike or surge then spills over to other demographics, those who are at higher risk. We mentioned the weekly phone calls that we have with our long-term care facilities, assisted living facilities, and all those folks are concerned. They're concerned about the pressure it puts on the vulnerable there. And so that's why this is a community effort by its definition, is ensuring that we're doing everything to protect the vulnerable, because that gets right back to your question, Bill, about those who end up in the hospitals. And so those numbers have increased. Those numbers are not at a critical level that we're having to go into our next plan or our surge plans, but that's the whole point, is trying to avoid that. So thank you for your question.
What are the numbers of those admitted to Brazos County hospitals that are outside of Brazos County?
So the number, the most recent number we pulled was 52. Bill's question is about how many outside the county. So, well, 52 total, Bill, and that includes the 31 who are Brazos County residents. So 52 minus your 31, so that's going to get you your 21 who are additional Valley, outside Brazos County residents who are currently hospitalized in our Brazos County facilities. And so at this point, I'll turn it over for the second part of your question, Bill, regarding face masks.
Thank you, Doc. Bill, I know your question is specific to masks, but we all know that masks are not the end-all, be-all. If that's all we were doing was putting on masks, we would not slow this disease down. So we still have to be doing all those things that have been pointed out by the CDC: washing your hands, social distancing, not touching your face, doing all those sorts of things. Masks are a tool in the toolbox, and I think their recommendation is that if you cannot do the social distancing, the 6 feet away, if you're in an enclosed environment, they recommend masks, and that's a good recommendation and probably something we should be doing. I personally, I'm not to the point that I think we ought to mandate masks, but I think it's certainly something we ought to be encouraging people to do. If this, as we move through this, I think it is an additional step to try to get this pandemic slowed down. But it is not the only way to get that done. So I've had a lot of emails, and the majority have said that we ought to mandate masks. I've had a few that have said, that they opposed the mandating of masks. And I don't want to do that, but I think we've got to keep our economy going. And I think the governor today was pretty clear that those are things we should be doing. If we don't slow it down, long term, I don't know, I would not want to even think about the idea of whether A&M wouldn't open or whether, we'd close the economy back down. So I think if we all step up and do the things that the CDC has asked us to do, and possibly without a mandate, then maybe we can get past this thing. We're not there yet, but
Howdy, Bill.
Yes, sir. Good afternoon.
Yes, sir. Well, I take a little bit of a different stance than the judge does, and my stance over the past week or so has morphed a bit. And while masks aren't the end-all and be-all, they are a tool. And I think if we just stop and say, well, we don't have to wear masks, then we're just making it more likely that particularly our susceptible age group is going to experience the illness, and for them, of course, it becomes a much more serious situation. If we are unable, and I say if we are unable because, as you noted, this is an agenda item for us at the College Station City Council meeting this Thursday night. If we are able to come up with a resolution, I don't expect us to come up with an ordinance just simply because of the way an ordinance has to be developed over time with hearings and so forth. But that said, I am hoping that we can prevail, as we did during the shelter in place, upon some of those businesses where social distancing just doesn't seem to be possible, and particularly right now. You may recall when the shelter in place was in effect, we had some businesses, particularly our grocers in the area, who decided that early in the morning, when their stores were the cleanest and traffic was light, that would be a great time for folks who are in the 60 and older group or others who were compromised by their own previous health concerns to come into the store for 2 hours, maybe 3 hours, or longer, who knows. But to me, it seems to be that might be a way to help address this, also make the environment a more health-conscious environment and a safer environment for those of our elderly folks who still need to get to the store, who still need to get out and do the things that they need to at various places throughout town. So seeing how things go over the next couple days, I believe that I may end up having some conversations with those local managers and seeing just what we might be able to do to accommodate the folks who feel that they are more susceptible. And quite honestly, some of the messages that I got, folks are scared. And so if there's something I can do to help them be able to go to the store feeling safer, feeling more confident, and perhaps not having to deal with all the people who aren't wearing masks, then I think that might be the right step.
Thank you.
Yes, sir.
Thank you. I appreciate the judge's comments and Mayor Mooney's comments. This is Andrew Nelson, Mayor Bryan. I think I would echo what both the judge and the mayor said, because I think they're probably 99% saying a lot of the same things, which is I keep likening this to a marathon. When you're long into a marathon, it gets exhausting. They call it a coronathon, and it can be exhausting. And some people at some point just say, well, why keep 6 feet difference? I'm tired of washing my hands all the time at home. I'm tired of, I'm kind of sick of this, and I just want to be done with it. And we just have to work very hard to resist that urge. And wearing a mask when you can't be 6 feet apart, wearing a mask indoor, there's benefits of that, wearing a mask. It reminds a lot of people, oh, that's right, I need to social distance. I hear some people say I touch my face more, but for me, when I have a mask, it reminds me sort of psychologically to not touch my face. So certainly, mandate or not for all of these things, the governor is today in his press conference, he asked us to help keep Texas open. Clearly, this virus, we've gone up a step. It's not shocking that when we reopen the economy, there's a lot more people engaging in the economy, even if we're doing the things at the same rate that we've been doing, wearing masks at the same rate, social distancing at the same rate. If there's a lot more engagement, that same activity, it's not surprising that it would increase our numbers. So our hospitals aren't overwhelmed right now, but the numbers are going up. We're all concerned, and I guess I would do everything I can to encourage people to not through their exhaustion, through this coronathon, please just keep up the good work and really press and do even a better job. It's not that we're doing a bad job, I don't think, but the economy's putting more pressure on the good job that we're doing. So I think we've got to just keep working hard. Anyone who can wear a mask, especially when you're indoors, certainly when you can't keep 6 feet apart, that's important. People who need to social distance, you need to keep social distancing, okay? Nothing has changed. If anything, it is more important. We want to get back to business, but not business as usual. We ought to be able to not choose between our jobs and our health. I think we can have both. Our lives and our livelihoods, as the governor said earlier today. So certainly echo that. I'm certainly open also to a resolution to encourage people to follow the Open Texas protocols and the guidelines that the governor has given. So just want to ask people to keep up the hard work. I know it's tiring, it's exhausting, but it's making a big difference, and it's helping us to keep our state open and keep our economy open.
Thank you.
All right, thank you, gentlemen, and thank you, Bill. On to KBTX.
Hi, Dr. Sullivan. It's Rusty. Thank you, sir, for
Yeah, Rusty.
Your time today.
Absolutely.
Hey, I'm gonna shoot you 3 questions here. One, do you have any more demographic information about those who are in the hospital right now in terms of their age ranges, and are most of them in stable condition, or are they in critical condition? So that's my first question. My hospital how many people we do have in Brazos County hospitals, ventilation capacity at each hospital, and bed count at each hospital. Is there any discussion or reasoning as to why that information isn't being made public daily along with all the other information we get daily? So that's my second question. And then my third question would be just asking you to extend on or expand a little bit on this job center that you're talking about with Workforce Solutions and Texas A&M. When are you hoping to get that up and going? Where would that be located? And where would the funding for that come from?
Okay, 3 good questions, Rusty. Thank you. And you reminded me. I did not mention. I might not have mentioned. If I didn't, I apologize. But that information, the DSHS COVID-19 dashboard, Brazos Valley is Trauma Service Area N. And I do not believe I mentioned that. I apologize. I should have mentioned that. But that is where this information can be found. And really, to answer, that kind of gets into question number 2. Where the information already is at this point of just being overwhelmed over here with just trying to keep up with contact tracing, the box it in concept, which is the fundamental, the blocking, tackling of this. That information is available there, and so we're referring folks to go and take a look at it. So that's number 2. But you're asking a good question on number 1, which is, what does it look like right now? And I don't have the demographics, the breakdown of all of that, but I can tell you roughly that about 15% to 20% of the individuals in the hospital are in an ICU. So whenever you're in ICU, you can be considered critically ill. In the ICU, there's more intense monitoring. There are, there's just the concern about getting worse. And then we also, you can look at the ventilator numbers there, and so you can look to see how many ventilators are being used. And last time we looked, I want to say it was like 27 or so. Of course, the ventilators being used does not mean that those are all COVID-related ventilators. These are just, the idea with the ventilators is to know how many ventilators are available in surge situations. So a good number to look at, Rusty, is the percentage of total folks in the hospital in the ICU. That's a good thumbnail estimation. And that's really been pretty constant at that. Now, I should say it's been constant here lately. What I will say, Rusty, interestingly, and I'm not exactly sure why this is the case, but of those in the hospital now, you're seeing less actually in the ICU compared to total numbers compared to back in March, April. And that may be because of medications that are available now, the remdesivir, we've talked about that. That may be some convalescent plasma that we're using, some other immunomodulating medicines that help with it. So, or just experience with this. I mean, make no mistake, they're still critically ill patients, but overall, there has been this trend that way. So we hope and pray that trend continues. But those are the numbers that we're seeing now. And then your question about the job center, and Chad, if you wouldn't mind, Chad's just done an incredible amount of work on this, and I'd really like to applaud Chad's effort on this from the university's perspective, and our director here, Santos Navarrete. These two together, what they have done between the health district and between the university to put together something as impressive as this center is innovation and a way to use local resources for the question that Gabriella had right at the beginning, which is, hey, we've got a university here, we've got a lot of young folks coming, how can we do this, and how can we do this together and do it safely? And these are the types of innovative ideas that have come forward and have become a reality. And so I'll allow Chad to speak to that, and specifically Rusty's questions were about a little bit about this job center, where some of the funding comes from, and an idea of its timeline and getting going.
Thanks, Dr. Sullivan, and thanks for the question, Rusty. I'm just kind of the spokesperson here on behalf of both mayors, the county judge, Santos Navarrete, who's our director here at the health district. We knew early on that contact tracing and contact investigation was going to be one of the critical tools, and so what we did at A&M was several of our public health faculty and a handful of our graduate students in public health came forward and have been working here at the health district on a volunteer basis. They have the training to do this in a pandemic. It's part of our education that we do for our public health students, and then it's part of the scholarship of these faculty. They were managing pretty well until about the last 14 days. As you all know, the case numbers have increased. And so we sought a way to formalize this process and to bring more folks together to help us. So over at the Health Science Center, Greg Hartman, who's leading our Health Science Center as both Vice Chancellor for Strategic Initiatives and Senior Vice President for the university overseeing Health Science Center, he cleared some space, created an operations center with the computer, phone lines, other technology they might need, working with our IT professionals, created a way for us to have access to a contact tracing software package. Then worked with the health district to keep their statutory authority in place for managing this pandemic. We offered our services. And then to fund the positions, our mayors and county judge leaned on our good friends at the Brazos Valley Workforce Solutions, Tom Wilkinson in particular, who always look for ways to maximize the Workforce Commission grants and Workforce Commission funds that are available to people in our community. And what he allowed us to do was identify 3 funding sources around dislocated workers, around workers who are learning a new trade, and then for certain age groups of workers as part of Texas Workforce Commission funding. And that will, over the next several months, allow us to put together about 50 positions. Those are posted right now on workintexas.com. If you look at the keyword search of Brazos Health District or Brazos County Health District, you'll see 3 positions there. They pay well. I think about all the folks in hospitality who might find themselves dislocated from work right now. Good customer service is the first barrier to these positions. And then our public health faculty will be providing training as well as some day-to-day management to bolster the work of the health district here and support Dr. Sullivan and Director Navarrete and the staff here. Right now, if you come to the health district, the entire staff here are working overtime trying to help do case investigation. They've had to stop some of the normal clinics that they do for our community that are not COVID related because we still have those impacts as well. But what we need to do is create this ops center with some help from A&M and some training and some space help from the Workforce Solutions with the funding, and then we need great people to apply to come help our community. It's a great way to bolster your personal salary while helping the community together. So those positions are available now, and we're ready to put people to work out at the Ops Center and to continue to support the health district's efforts during this pandemic.
Hey, one more quick question, Mr. Wooden. Is there a formal name to this or anything that you guys are calling it specifically?
Yeah, we'll probably have some release information out, but we're calling it the, right now, Brazos Valley COVID Investigation Operations Center. I know that's a wordy title, but trying to just encompass the role and the purpose of the set of services. Again, it operates under the authority of the health district in support, with support from Texas A&M. Actually, we have regional partners. I failed to mention, I know there's a lot of discussion around the 18 to 25-year-olds who are part of this spike around our state. The college, someone, I think maybe Gabrielle asked earlier about university preparation. Our friends at Blinn are similarly working on their preparations, and they have joined this operations center with some funding to support the management and ongoing operations cost as well. So we're all kind of in this together, thinking regionally about how we box in this virus, and so we look forward to doing that. We can send something out a little bit with a little more detail, Rusty, but really just in the last, over the last weekend, we were able to get all the authority approvals and get the jobs posted.
Awesome. Thank you, sir.
Thank you, Mr. Wooten, and thank you, Rusty. And on to the Eagle.
Hey, Dr. Sullivan, this is Kenny Wiley.
Yeah, hey, Kenny.
Hey, so I've got two things. The first is a follow-up to Bill Oliver's question, his first question, and then I've got a question of my own. So the follow-up first, expanding on his question a bit ago about hospital capacity, I'm hoping you could, you mentioned the contingency plans. So Dr. Sullivan, I'm hoping that you could refresh our memories about those surge contingency plans if capacity becomes more of a problem. The second thing, also for you, Dr. Sullivan, is I'm hoping you can expand a little bit on two pieces of data in today's update: the community spread percentage, as opposed to or compared to the cluster-related percentage, and also on the positivity rate, which you mentioned was at 24.39 in the last week. So could you help us understand a little bit more about what's going on with those two data points in particular and what they're telling us about where we are right now? And thanks so much.
You got it. Thank you, Kenny. So two questions Kenny had. Number one is an expansion on the hospital capacity question that Bill had asked earlier, and specifically around surge planning. How does that look? A lot. It's a very detailed plan, Kenny, and at the end of the day, in big picture, it's this. We have hospital beds, we have rooms, and we even have beds that go in there, but we don't use these rooms on an everyday basis. This has to do with staffing. So, how many nurses you have per bed, how many, think about all that goes into do food services, and really at the end of the day, we use what we need. So as we in a hospital start to use more, we'll have to get more staffing. So that staffing can come from those who are willing to work overtime. That staffing could come from temporary agencies. That staffing could come from individuals who are willing to help out from other areas. That staffing could even come from state resources. And so we would like to keep all patients in hospitals for obvious reasons. And so if we exceed that, so we're talking about different plans, or surge levels, if you will. God forbid we move beyond that one. Then we have other plans that would be around helping get state resources to help, and by state resources we're talking about the things we need to take care of patients, including the staff who would be deployed, if you will, to come here. The state keeps a very close eye on this. Again, Chelsea Elmore, who I've mentioned before, has done a great job of keeping up with, keeping us in tune with all of the hospital capacity information, does a good job of maintaining that link, that coordination there, and others as well. There's redundancy there. But the idea there is that they are aware of where our numbers are, where we're at, and what we would need, where we would need to be when we hit those levels. And so drive home point today, Kenny, is that we don't want to be getting to those surge plans. They're all there, they're all detailed, and they're all available. But we don't want to be going there. And what we're looking at is the percentage of actual hospital beds in our area. You asked about community spread, and I don't know if in the past it's been around the 40% range. Did you have that off your top of your head, Sarah? That I might have skipped right over it, but that's been, Kenny, that's been that kind of 50% range, if I remember right. That's been cluster related, the rest being community spread. And so what we've been seeing is a trend toward, I can tell you the trends, toward more of a community spread. That becomes more and more of a challenge. That means to call a case and say, hey, do you know where you got this? And they'll say, well, I mean, it could have been here, here, or here. And so it's tough to say that they were from this particular cluster, if you will. If we are able to trace them to, oh, this is a person you were around who is already on the list as a case, we call that a cluster. At the end of the day, it is community spread, it is person to person, and that's what continues.
So over the last week, it was 68%.
Okay, so thank you. So it was 68% over the last week. So 68% community spread, which means that the remainder there, the 32%, is going to be the cluster related. So just as we're saying here, that there is that less of a tendency to be able to identify one of the previous cases who are there. And Kenny, you asked one more question. I can't even read my own writing here. You said something about, so community spread, and then I think you had a third part of that.
Yeah, about the positivity rate.
Oh, positivity. Yeah, thank you. That's what it says. Positivity. Wow, that's impressive. So the positivity rate, yeah, you were asking about that. Good question. We are increasing. That's increasing. We're at 24%. 24, that's the highest that we've been. And again, the positivity rate is how many positive cases per how many cases being sent off. And so there was a question about, well, there's more cases because we're testing more. We've talked about our mobile units. We talked about widespread testing in long-term care facilities. We've talked about more testing being available at our urgent cares and our emergency rooms. So the question then becomes, well, if we're testing more, then aren't we going to have more cases? Well, yes, there's some truth to that, but as we're testing more and we're seeing more and more positives per test sent off, then clearly this is not just a testing phenomenon, and this is indeed more transmission in the community. And so we see that number, Kenny, at 24%. The week prior to that, it was 10%. So that number continues to increase, which is consistent with what we've been talking about today, last week, and as all of us, the governor has mentioned today, and as we've seen, that there is more community transmission. And so this gets back to that fundamental concept that we've been talking about 3 months that remains more critical than ever, that we must be social distancing. We must be wearing our masks, especially if we're going to be in an area where we cannot maintain that social distancing for whatever reason. We need to be out of that situation as soon as possible. We need to be staying home when we're sick. We need to be using hand hygiene frequently. These things we know work. We've seen the data. We've seen the evidence throughout the world as the world learns more about COVID-19. I want to thank all of you for your attention today. Thank you, Sherry, for your hard work today. I can't believe your arms don't get tired, but you are impressive, and thank you for all of your work. To our media partners, to Sarah for getting all these points together. We will be back next week at this time at 4:30. You all have a wonderful week, and we'll see you next time. Thank you.